exercises, the three S's, sleep, stress, stability. There's lots of things that I wish I started 20 or 30 years later, because what happens somewhere in your 30s or 40s, the body starts to decay. And we're going to learn how to keep that plane or keep your body going for as long as we can. And let's hear more.
So this is the video here from Toronto Pearson Airport and prescription renewals. We were talking about today, Dr. Curnew. I don't know if you had some comments to say about prescription renewals at the clinic or anything like that.
I think Toronto Airport and most airports are utter chaos at this point in time. And I think prescription renewals, at least in our clinic, is utter chaos. Is that we're spending about 2,000 patient visits just for prescription renewals, and over half of them are prescriptions that have already been sent off. And so I need, and the reason this analogy to plane flights is that before a plane takes off, it has to go through its checklist. And before you have your visit or in your health, the most cause of preventable errors that you can change is getting your medications right. And what I'm seeing is that many people stop, modify, don't know when their prescriptions are coming through. Pharmacists, despite being sent all medications, are still asking for medications again. So we need to think about how to change this scenario. Right now, air travel has become is trying to fix their problem. We need to fix a problem about prescription renewals. So my plea to everybody is to always bring your medications to every visit, always know what you're taking, and know when you're going to be running out of medications, know what physicians are prescribing what medication, and know what your medications are for. Um, that sounds like a lot, but that's sort of essential part of your health. And we have a number of videos, and everybody should look about prescription renewals because, again, um, it's common to make mistakes, but it's becoming a huge problem is that we're diverting so much resources to getting your medications right. You need to devote resources to getting your medications right as well. So what I'm starting to do is that if I can't know exactly what you're taking, I can't give you a prescription renewal, and I might have to, for some people, is give that responsibility to the family doctor, because I just don't know what you're taking, and you don't know what you're taking. So we need to fix that problem. So that's my 2 cents there. Uh, Amir, do you have any thoughts about that?
Yeah, I mean, as a volunteer at the clinic, we do those prescription renewal calls, and they obviously, like you said, Dr. Curnew, they take time and resources, and we can avoid them with bringing your medications to appointments and, just making sure you get them refilled before they need to be renewed by you, or telling you at their recent latest appointment what medications they need renewed. Yeah, those are my thoughts on prescription renewals.
And the sad part is that what I like to do, I see you in person, we decide what pills you're on. I renew them all for a full year. I usually give a 100-day supply with 3 repeats. And what I'm finding is a few months later, the pharmacist is trying to do this pill or that pill a few months afterwards. You need to work with, that's not right. We need to fix this problem. So I'm looking for solutions here, and I know Air Canada and other airlines are looking for solutions too as well. Let's fix this problem so you can have clear sailing, clear flying, better health. And we're going to learn other ways of being healthier today: the power of exercise, power of sleep, stress management. These are important factors that I know is that I've been guilty in the past of not sleeping enough, so I'm working on my sleep. I've also realized that as I'm losing 50% of my muscle mass. I'll repeat that. I am losing half my muscle mass, and that starts in your 30s and 40s. By the age of 70, most adults have lost 50% of their muscle mass. So that means you're getting weaker, you're going towards closer to the nursing home, your metabolic rate goes down, you can eat less, and it makes it hard to lose weight. So I'll show you what I'm doing, and I hope you do the same thing too as well. So Haley, the team have put together a wonderful presentation. Let's hear more. And by the way, I'm going on a vacation tomorrow. I'm going on an exercise vacation. My wife has chose this fitness guru that we're going to go visit, and they're going to beat the hell out of our bodies for a couple of weeks, and we're going to have fun doing it. So if I can do it, you can do it too as well.
Okay, so thank you, Dr. Curnew, for that wonderful introduction. Today, we're going to walk through 4 different topics with you all. The first one will be sleep, the second will be stress, the third will be stability, and the fourth will be persistence and motivation. So how do we actually work on getting ourselves to do the exercise we're claiming is so beneficial to do? So, the first thing we thought we should discuss is kind of how important it is to exercise and specifically how much exercise we really need. So, it's recommended that we complete 150 minutes of exercise at a moderate, vigorous intensity and 2 days of muscle training per week. I've included some examples here of different um, like aerobic exercises and muscle strengthening exercises that you can kind of take into account. But for some, this may seem like a huge goal that might start off feeling really intimidating. I know when I first learned this fact, I realized, oh wow, I was not at these kind of levels as I should be. So in order to get myself into actually reaching these levels, I worked in different strategies like building up. So what that would mean is starting off small. So maybe trying to do a 30-minute walk a day. That will kind of build you up to make sure that you can kind of reach these milestones. And when you're doing this, it's really important to kind of keep track of the exercise you're doing. So maybe keeping a little notebook of and logging your exercise each week. It's a great way to kind of keep track of how many minutes and how much exercises and what type of exercises you're doing. However, it's really important to keep in mind that some activity is better than none. Not everyone will have achieved these different milestones every week. There will be some weeks where life is busy, and that's just something that's going to happen regardless of who we are or what's going on. And that's okay. But as long as we're doing some activity, like choosing to take the stairs instead of the elevator on some occasions, that is going to build up and ultimately provide ourselves with the benefits of exercise. So when we
hold on for a second. So I grew up in a generation where we praised aerobic activity. And one of the things that people, and I think you're right, the most important gain is going from nothing to something. That's important. But simply walking 30 minutes every day or doing your 10,000 steps a day is one form of activity. But you mentioned 2 other important things: 150 minutes of moderate to physical vigorous activity. That means when you're exercising, you're having trouble talking. You can still talk. So that's not walking. That's not going for walking your dog. That's not going with walking your next door neighbor. And then this business about muscle training, that is a key. And one of the things that some of these longevity experts are feeling that is a forgotten potion to make you live longer. So I think there's 3 forms of exercise. One is just regular walking activity. That's great. One is vigorous, where you're actually getting your heart rate up there. You're feeling a little bit stressed. You're panting a bit. You know, you still can talk, but it's a little challenging. And probably the most important one that we all forgotten is at least 2 days, maybe more, minimum of 2 uh, lifting weights, doing some push-ups, using resistant bands, and that's hard work. And you know what? I've started to do that since April of last year, and it's starting to have some benefits right now. I should have started 30 years ago. I remember when I was in my 20s, I was rowing and I was supposed to do weights. I did them for a little while, then I got away from that. And I went back to aerobic activities. I'm now back to weights, and we're gonna tell you why in a second. That is one of the key clear clue benefits. And for some of us will be those chair exercises with bands to start off with, and for some of us will be actually lifting weights. And I'm lifting weights and I'm doing these bands, but I'm not doing it without the support of a group and also the support of of a trainer who knows what they're doing. I would hurt myself without that. So tell us more. So if I can do it,
Yeah.
you can do it.
Thanks, Dr. Curnew. So, Dr. Curnew kind of mentioned some reasons why we exercise, but let's talk about a few more. So the reason we encourage you all to exercise so much is because it has a variety of positive effects on our body. So here we have a little diagram kind of outlining our bodies and the different parts of our bodies that exercise can impact. So for instance, if we look at our brain up there, exercise can help improve things like sleep, which we'll be talking about a little bit more later, and lower the risk of things like dementia and decrease depression and anxiety, which we will also go into a little bit more detail about. Additionally, when we look at our hearts, physical exercise also has positive implications on our cardiac health, which can include decreasing our risk of cardiovascular disease, as well as decreasing our blood pressure, and ultimately also decreasing our weight, which is really beneficial when we want to start making sure our heart is working okay. Exercise also helps in a variety of different ways to improve things like independent living, which can help prevent you from moving into a retirement home in the future. So it can help you stay living in your home for longer rather than transitioning to that maybe might not even be a next step for you in life. This is especially seen because it helps strengthen your bones and improves your balance and coordination. This is just kind of a general overview of the positive effects exercise can have, but in this presentation, we'll go a little bit more into details on some specific benefits. On to the next slide, one specific example we wanted to mention was this motor trial, which was conducted and published this year, which compared running versus medications for depression. So what the study did is researchers had about 141 people with depression and or anxiety complete a 16-week treatment intervention of either antidepressant medication or group-based running therapy. And that group-based running therapy occurred at least twice a week. So the researchers actually found at the end of that 16 weeks that remission rates, which meant the depression and anxiety symptoms were in control, were comparable between the running group and the medication groups. However, what the researchers did find was that the running group outperformed antidepressants on improving physical health in the areas of weight, waist circumference, blood pressure, and heart rate. So this study really kind of shows that implementing exercise therapy is something we should take a lot more seriously in our health, and it could be an awful choice for some people with depression and anxiety. Running can be helpful at reducing these depressive symptoms and should be considered a little bit more. I don't know, Dr. Curnew, if you want to go into a little bit more detail about the study.
I think this is something that's actually really important because the standard treatment for depression is antidepressant medications. And you can see the success rate is about 50-50 for a drug. And this trial showed that exercise, this was done in a group training, I think at least 3 times a week for about an hour and a half. And it showed that this roughly you get the same relief of depression, but you weigh less, your blood pressure is better, your heart rate's better. And so all of us want to take less medication. So here's a way of treating depression. I think this is fantastic, but the compliance rate is always a problem. Is that people? It's hard enough to take a pill. It's even harder to exercise 3 times a week. So maybe what you could do is get that prescription filled with antidepressant. Just pick it up, take it for an hour and a half walk 3 times a week. Do a little bit of weights training, group training, and you'll feel better. This is not severe depression. It's a relatively small trial, but this is really fantastic. You can say to your doctor, you know what? Instead of putting on antidepressant, I'm going to exercise. If you go back one slide, just go back a slide. Go back another slide. Go back a little bit more. I'm going to go back. See all those back? Go back one more. I'm going to spend 150 minutes of moderate vigorous activity. I'm going to do two days of weight training. Go advance the slide forward. I'm going to have less depression, better sleep, better bone mass, less falls, less chance to have dementia, less chances about 6 or 7 cancers. keep going forward. So this is actually a randomized trial, relatively small, but shows that you have some choices here. And I think it's fantastic. I just saw this a couple days ago and I said, wow, we now have a good we have a small randomized controlled trial that has some problems in its design, but this is an alternative to antidepressants for people who have minor depression or any thoughts at all. I think it's great, but you have to do it. You have to spend an hour a day with activity and good activity. And usually this was done in a group setting. Now people say I do activity myself. I don't know about you, I'm not going to do an hour of activity most days. I'm going to do my weights and things with another group of people. I go Monday mornings and Wednesday mornings between 6 and 7. I paid big bucks for this trainer to beat the hell out of my body, and it's the best investment I ever did in my health. And there's a group of us. I play squash. I do other things as well, and I'm having fun getting this process done. So if I can do it, and I think I work probably twice as much as the average person. I'm not saying it's good or bad, but that's what I do. And so you should do it too. And my wife does it, and she's actually much fitter than I am. That's where we're going to go. So our vacation is an exercise vacation. Tell us more.
Awesome. Thanks, Dr. Curnew. So another study actually we wanted to mention that compared exercises with medications was looking at erectile dysfunction. So exercise's impact on erectile dysfunction was assessed, and researchers actually found that exercising regularly can be nearly as effective as medications like Viagra for erectile dysfunction. Specifically, men who had the most severe erectile dysfunction improved the most with exercise. So this is a really promising outlook for those who may not be able to use erectile dysfunction medication due to things like medical contradictions or intolerances to side effects. They also found in this study that it actually improved sexual functioning as well. So that's another positive from exercising. So physical exercise may provide this outlook for these individuals, and also be at a lower risk because exercise may put you at a lower risk because you're not consuming medications, and it might be more affordable too, because to exercise you can do numerous exercises for free, and it's a more available option for some people because you can do it at any point of the whole day, whereas medications can sometimes be a little bit difficult to get. I don't know if you wanted to talk a little bit more about this, Dr. Curnew.
Here we have another randomized controlled trial. We know as males get older is that 50% of males will complain of some form of sexual dysfunction. And this shows that exercise is as good as Viagra. I'll repeat that. This trial shows that exercise is as good as Viagra-like medications for sexual dysfunction. And people who had the worst sexual dysfunction had the most to benefit. So I think this is another option to many of us that want to find another benefit of exercise. So I just think this is just incredibly good news. And the trouble is that if we were going to put exercise and market it as a pill or an injection or whatever, it would be so expensive, unaffordable, because the benefits are so immense. But really, it's the effort you put into this. So I think most of us have to think about this, especially as we get older. We start off saying this, that as we age, our body loses reserves. Our lungs get weaker, heart disease becomes more common, our brains don't work as well, everything happens a little bit slower, erections are a problem, sadness becomes an issue for some of us. Good randomized control trial. So randomized is high quality information showing that you can actually improve your sexual health by exercise. So I think this is wonderful. And we just showed that about improve your mood as well. So you have some choices here. So people say, I want to take less medications. Well, I see lots of reasons why that exercise can work, but you're going to have to find the time to do that. So you have to make some choices here. And I make the time and you make the time. Keep telling us more.
Perfect.
Yeah, awesome.
Sorry, just to jump in here with some videos of Dr. Curnew's weightlifting recently. Sorry, I'll just get those videos up. Here we go.
You can laugh at my weaknesses and things of nature. So I'm really having a lot of fun. My reason I started these programs, I'll be quiet. Just go ahead.
Oh, okay. So it looks like we have some technical difficulty with that file format there. Let me see if I can.
So one of the things is that I started these program because dementia, 3 family members, both my parents, my brother struggle with their memories, and falls became a problem. So I started a fall prevention program, and also a way to help delay the onset of dementia. You can argue I may be demented already, but let's see what comes out of this video here.
I don't think we can play it, unfortunately. I think the file format isn't working on my computer here.
No trouble at all. So
I'll switch back here. All right. I'll hand it over back to Haley. Sorry to interrupt you there.
No, no worries at all. So, we have been preaching at you to exercise and how positively it can impact our bodies. So, today, throughout our webinar, we're going to sprinkle in about 5 exercises that we're going to complete together. And these exercises are going to primarily focus on our stability. So, they're going to work our core. So, the first exercise we are going to do are diagonal chops. I apologize for that noise that my chair just made. So we're going to do 8 chops on both sides. So in order to do a chop, what we're going to do is we're going to put our arms up in the sky, and our feet are going to be about a little bit wider than shoulder width apart. And we're going to twist our body down and bring it back up. So that's 1, 2, 3, 4, 5, 6, 7, 8. And we're just going to do the same thing on the other side. So 1, and if you want to make this harder, what you can do is hold like a water bottle or a weight at the top while you're doing it, but you really want to get that twist in your body in order to work your abdomen. I think we're at 6, 7, 8. Okay, perfect. So there's going to be a few more different exercises kind of sprinkled throughout, so we encourage you to participate as you watch. So now kind of into the 3 S's, which this whole webinar is kind of centered on, we're going to start off with sleep. So when we think about sleep, a common question is, how much sleep do we really need? It is recommended for adults to sleep between about 7 to 9 hours each night. Adults who sleep less than 7 hours a night may actually have more health issues than those who sleep for more than 7 hours each night. Sleeping more than 9 hours a night is actually not necessarily harmful, but it may actually be helpful for people like young adults, individuals recovering from sleep deprivation, and individuals who are sick. So the next slide, we're going to talk a little bit about the importance of sleep. So sleep is vital for good health throughout one's life because during sleep, our body works to support our healthy brain function and maintain physical health. Inadequate sleep over time can cause an increase in risk of chronic health problems, which also impact how one can actually think, react, work, learn, and interact with others. So as you can see on the diagram we have at this side, our sleep can helps impact a variety of functions in our brain, such as organizing new information. It can help solidify our memories. So all those happy moments we want to keep in mind and keep in our minds, we should sleep in order to keep them there. It also leads to creative thinking. It helps clears out harmful toxins. It regulates our appetite. So if we're ever feeling like oh my gosh, after I had a really bad sleep and you're just feeling like I'm so hungry the next day, that could be why. It could be related to your sleep, not necessarily that you're hungry. Also, it helps keeps our body healthy and it helps us keep an efficient thought process. So on the next slide, we're going to talk a little bit about the impact of sleep on different health systems themselves. So if we're talking about the circulatory system, sleep actually helps our blood pressure and heart rate because while we sleep, it falls. So it gives it time to kind of rest. Because when we are sleeping, our parasympathetic system, and that's our rest and digest system, controls our body so that our heart doesn't have to work as hard. So giving your heart a little bit of a break throughout your stressful day is a really good time, and sleep is an optimal time to do it. And when we wake up in the morning, our sympathetic system, which is our fight or flight system, is what is activated, which will actually increase our heart rate and blood pressure back up. So while throughout the day we have maybe high blood pressure, high heart rate, we're exercising a lot, we're moving our bodies, we're going from this place to that place, that taking that time to sleep helps our heart kind of relax and regain its function in order to function for the next day. Not sleeping enough or infrequently walking during sleep, if you are a sleepwalker, may actually result in a higher risk of coronary heart disease, high blood pressure, obesity, and stroke. So when we look at the metabolism, our circadian clock actually impacts how our body stores fat. Studies have shown that insufficient quality sleep can actually contribute to our obesity through increased hormones that control hunger, decreased ability to respond to insulin, increased food consumption, decreased physical activity, and metabolic syndrome. So if we want to kind of combat all of those things, we want to prioritize our sleep in the day and make sure we're getting that 7 to 9 hours of sleep. Now, looking into the season we have, which is cold and flu season, the immune system is so important that we work to ensure that it's working at its highest function. So we can do that through sleep because parts of the immune system are actually active during different types of the day. And certain immune cells work harder in our sleep to kind of combat those diseases or sicknesses that might be coming in our bodies. So if we have inadequate sleep, we might actually get a higher likelihood of having colds or other infections. I know for me, if I get woken up in the middle of the night and can't fall back asleep, I wake up the next day and just feel so sick. And a really key part of that is because I didn't get the sleep my body needed. So if we're moving on to what exactly exercise does to improve sleep, we have two studies here that we wanted to show you. First is a meta-analysis that looked at how physical activity actually affects sleep. And they found that cortisol, which is the hormone associated with stress, negatively affects sleep. So what that means is that if you're really stressed out and have high levels of cortisol, you're not going to sleep as well. But what they found was that physical exercise actually decreases cortisol and therefore leads to improved sleep quality. So we're going to talk a little bit more about stress later on in the webinar, but it's really important to remember that sleep can kind of help us combat that stress. Another meta-analysis found that efficiency of different types of exercise looked at the efficacy of different types of exercise on sleep. They found that things like muscle endurance training combined with walking, Tai Chi, resistance training combined with walking, and resistance training alone all significantly improved sleep quality. But the one thing that they found increased sleep quality the most was muscle endurance training combined with walking. So going back to that whole discussion we had about how important weightlifting and things like that are building up our muscles endurance, it's really important that we prioritize that in our weekly schedule because not only will it help our bodies function and help us become stronger, it will also help us sleep. And they found that it was the best option for 88.9% of adults. So that's a majority of adults. So that's a really important thing to try and prioritize in your life. So when we're actually looking about exercise and we're telling you to exercise and you're like, well, when the heck am I going to exercise? We're going to talk a little bit about the different times of the day and what that effect that may have on exercise. So if you're completing exercise in the morning, you might want to focus on aerobic or resistance training because that may stimulate early melatonin release in the evening, allowing you to fall asleep sooner. So morning exercise can actually help stable circadian rhythms. So if we prioritize exercise in the morning, although we may be a little bit tired getting used to a routine as we incorporate this, in the long run, it'll actually help our sleep in the evening. Afternoon, they found that high intensity exercise may promote sound sleep by reducing wakefulness. So it may cause drowsiness due to lowered orexin levels, a neurotransmitter that actually promotes wakefulness. And in the evening, light resistance or aerobic training may actually reduce nightmare awakenings. So if you have a problem with nightmares, maybe trying to do light resistance or aerobic exercise in the evening might be optimal for you. And moderate to vigorous exercise within 1 to 4 hours of bedtime may actually delay sleep, decrease sleep quality, or increase nighttime awakenings. So I know for me, I am doing intramurals at my university, and a lot of the games have been at like 9:30 to 10:30 at night. And although I'm getting active and I'm getting out there and moving my body, it can be a little bit difficult for me to fall asleep after because I'm so hyped up on adrenaline after that really intense exercise. So maybe in the future, if I am going to do intramurals, signing up for some that happen more in the afternoon or the morning might be more ideal for me to improve my sleep. So when we actually think about when we should exercise at night on the next slide, we have 2 studies that kind of looked into it. So the first one was a meta-analysis, and it looked at how evening exercise affects sleep. What they found was that evening exercise significantly increases REM latency by about 7.7 minutes and increases deep sleep, lowers sleep efficacy, and increases nightmare awakenings. So higher intensity exercise is higher intensity exercise lowers sleep efficiency more and increases nightmare awakenings more. So when we're thinking about exercising, again, if you're doing that high intensity, try and prioritize it earlier in the day. Another meta-analysis found that regular high intensity exercise did not actually disrupt nighttime sleep, and acute evening high intensity exercise 2 to 4 hours before you sleep didn't disrupt sleep at all. So as we can see, as we've been preaching to that maybe it might not be ideal, the data is pretty conflicting. And what we really want to emphasize is that if you find that, let's say for me, again, going back to my example, exercising in the evening at that high intensity did impact my sleep negatively, morning exercise was a better option for me. However, someone else who may be more of a night owl may actually find that exercising in the evening is better for them because in the morning they'd be too tired to actually get up to that intensity. So try out different methods and find out what actually works best for you. So that's kind of our little thing on sleep, but we're going to transition to talk a little bit about to transition into our next exercise, which will be high knee marches.
How much sleep you need is very much individual variation. Some of us need less than others, but I think if you feel rested, you probably are okay. When you're a baby, you need 12, 14 hours sleep. As you grow older, teenage years, you probably need more sleep. As you get older in life, you need less sleep and it becomes more fragmented, and the quality of sleep does go down. But there's a lot of different things on sleep hygiene, going to bed at the same time every day, not different on weekends, making the room dark, your bedroom just for sleeping, and making it a little bit cooler. And you can decide whether or not you want to listen to music before going to bed, watch TV, turn off your emails or not. I find putting on one of our webinars or any webinar helps put me to sleep, and I usually fall asleep with a webinar playing, and that seems to help my sleep pattern. So if you have trouble falling asleep, watch one of our webinars, and if you're like me, you'll sleep better that night. But I have been sleep deprived for many years, and I'm working harder on that area there. And for me, if I get 6 hours of sleep, that's a good night's sleep for me. 4.5, 5.5 hours. Now, I use Fitbit. Fitbit is not totally perfect. It says about an hour of my sleep time is not actually sleeping, and I do get up to go to the washroom at nighttime. But I think, but paying attention to sleep, because sleep is not a passive effect. As you mentioned, it detoxifies the brain. It sets memory into place. It's not passive. It's a cleansing time of your brain, so it removes different proteins. Tau protein maybe delays Alzheimer's disease. We're learning about that over time. So I neglected sleep. One of the things that the first thing I neglected was resistance training. The second I rejected sleep, and I'm concentrating. I'm 64 right now, and my body's aging, and I need to take better care of itself, and I'm doing that. I hope you are doing that too as well. Tell us more. Tell us more. What's the next exercise?
Yeah, so the next exercise we're doing is high knee marches. So we have both a beginner example and an advanced example. So what we're going to do is we're going to do it on both sides. So I'm going to walk you through the advanced example for the first set, and then for the second set, I'll do the beginner example. So the advanced, you're going to bring your arm and knees kind of down as you're going to it. So we're going to do 8 this way. Think that 4, 5, 6, 7, 8. And let's just all together do the beginner as well, just as getting us used to it and seeing it all together. So to do the beginner, you're going to do it rather than having your arms up at your sides. And you want to make sure you're doing the opposite arm to the opposite leg. So that's 1, 2, 3, 4, 5, 6, 7, 8, 9. Oh, I did an extra one. Oh, well, that's okay. It's better to get moving as long as we can. But that is kind of wrapping up our little thing on sleep. And then we're going to walk you through a little bit more about stress.
So as Haley mentioned, the second S we have is stress. So first we're gonna start this portion of the presentation by explaining what is stress. So stress is a physiological and psychological response to stressors, also known as stress triggers, which leads one to feel like they're in a state known as fight or flight. Within this, stress can be caused by something that is relative, which would be an implied threat, such as public speaking or or worrying about submitting an assignment late, or it can be caused by something absolute, which would be a real threat, such as being face to face with a dangerous animal. Stress can also be pronounced or mild, and it is individualized. So how stress works physiologically is that stress results in the hypothalamic pituitary adrenal, also known as HPA, axis in the brain to be triggered, which then leads to neurons in the hypothalamus to release corticotropin releasing hormone, which then subsequently triggers the release of adrenocorticotropin from the pituitary gland. And then all of this then results in the adrenal glands releasing 2 types of stress hormones, catecholamine, which would be adrenaline and noradrenaline, as well as glucocorticoids, which would be cortisol. Both of these are then responsible for their fight or flight response feeling as both heart rate and blood pressure increase. So then the picture on the slide is just kind of illustrating this whole process, how the signals within the brain go to the adrenal glands to release the hormones that increase heart rate and blood pressure. So although an acute stress response can have some benefits, such as promoting survival and adaptation, prolonged stress leads to various negative health consequences. So first and foremost, prolonged stress leads to negative lifestyle changes, such as poor sleep quality, which, as we just talked about, increased engagement with smoking, drinking, and other substance abuse, and etc. This is because of something called allostatic load, which is defined as the physiological cost of a body to adapt to a stressor and then cope with that stressor to try to achieve homeostasis. Another negative consequence is that prolonged stress increases the risk of developing arterial disease, diabetes, and hypertension. So this is because with prolonged stress, there is a prolonged release of glucocorticoids that antagonize insulin by stopping insulin-mediated glucose uptake, as well as your blood pressure being elevated for longer periods of time. And then last, but definitely not least, in the negative health consequences is that prolonged stress leads to decreased immune function, which, as we talked about with sleep, so as well as an increase in low-grade inflammation and an increased susceptibility of developing certain types of cancers. So this is because chronic stress deregulates type 1 and type 2 cytokine balance alongside suppressing the functions of immunoprotective cells such as protective T cells, and type 1 cytokines, which all play an important role in maintaining proper immune function. So with the theme of the whole presentation is how it connects to exercise. So how is exercise and stress connected? So physiologically, exercise is actually seen as a stressor to the human body since during exercise, the HPA axis is activated. However, what's important is that with regular exercise, when the body experiences other stressors, there won't be as great of an allostatic load because through exercise being a stressor, it becomes trained. This means that with regular exercise, a greater capacity in handling stressors while using less pituitary adrenal activation will occur. And then to connect it with the previous slide, exercise helps counteract the negative consequences of stress, such as reducing one's risk of diabetes and lowering blood pressure. And there's another connection. So with this relationship, although exercise can help with stress, stress often leads to physical inactivity known as behavioral inhibition. So it's kind of like stress, exercise helps with lowering stress, but then stress makes you not want to exercise. So what's kind of the best exercise for combating stress would is that so although this although the study wasn't specifically targeting stress, instead it looked at anxiety sensitivity, which is defined as the fear of anxiety and sensations associated with it. So for example, it's you feel your heart rate increasing and then you start to panic that you're going to have a heart attack. So although it does differ from stress itself, they do share kind of the link of a fight or flight sensation that I felt could be relevant just because there was a very limited amount of studies that look specifically at stress and especially in the sense of aerobic and anaerobic exercise. So I kind of feel like it could be, this can relate to the stress. So the study itself is done by Broman Folks et al. In 2004, the results concluded that aerobic high-intensity exercise was more effective in reducing anxiety sensitivity when compared to the group that did low-intensity exercise. So the high-intensity aerobic exercise was either jogging or briskly walking on a treadmill at 60 to 90% of the participants' age-predicted maximal heart rate for 20 minutes, 2 to 4 times per week, and was conducted over a 2-week period. So the low intensity group also did use a treadmill, but was maintained at a 1 mile per hour speed, and the heart rate could not be above 60% of their maximum heart rate. And then the image attached to the slide just looks at the bodily, it's just the data from the study and comparing the BSQ, which is the Body Sensations Questionnaire, which looks at the bodily sensations and the related panic, results between the high intensity group, which is the bottom line, and then sorry about that. It's the high intensity group is the bottom line, and then the low intensity group is the higher line. So pretty much it just shows how after each treatment, the BSQ scores become lower as the study progressed, and that there was a significant decrease in the BSQ scores done pre-treatment and post-treatment, but also how much of a difference there was with each treatment. There, like pretty much if you just look with each treatment, it goes down, the BSQ scores go down, and then between the high intensity and low intensity groups, you can see how much of a difference there is as the treatments progressed. And in the study, it still said that like although there were greater significant changes with the high intensity aerobic group being more beneficial, low intensity exercise was still beneficial. And pretty much the whole message of everything is any exercise is good exercise. So with that, one of the ways to enhance the benefits of exercise is practicing yoga as well as doing aerobic exercise, as it was shown to reduce stress, and it would be a beneficial addition, as well as exercising in a natural setting or outdoors can be beneficial as it's perceived to be more calm, which in turn is associated with greater effects in reducing stress. However, there's no scientific proof that exercising in a natural setting compared to a non-natural setting has greater benefits. It's just a perceived calmer environment. And lastly, exercising in a group or with a friend can help with adhering to regular exercise. So this is another exercise that we have implemented. So as we talked about high intensity aerobic exercise being more beneficial, we wanted to do something that's gonna kind of bring your heart rate up. So we're just gonna do a little jumping jacks. Sorry, I'm just gonna kind of set myself. So first, just the beginner classic jumping jacks. So we're gonna start with just our legs together and our arms to our side, and we're gonna jump shoulder width apart. So we're gonna do 10 of those. So just 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And to make it harder, we can either add a resistance band to our legs, we can go faster, and also for doing multiple sets, we can just take shorter breaks in between, as well as holding kind of dumbbells or a water bottle, something heavy in both of our hands to just add some type of resistance while keeping the same pace.
Awesome, thank you. So the next topic we're going to kind of discuss here is stability. So what is stability? So in terms of balance, stability refers to maintaining an even distribution of weight that allows you to maintain a steady position like remaining upright. Stability is involved in almost all actions, whether they involve movement or holding a position still. A lot of the time, stability is a second thought because we don't actually acknowledge because our muscles naturally hold positions without us having to think about it too much. But when we lose our stability to things like aging, we have to focus more on the actions we're doing as they are not necessarily automatic anymore. Everyday tasks that involve stability are walking, dressing, standing up, turning around, and looking in different directions, and overall fall prevention throughout the day. Some long-term effects of stability are injury prevention, reduced reaction time, which means you react to things a bit quicker, improved posture, increased joint strength and support, and lowering stress. As mentioned previously, it takes less energy to think through actions when you have stability, which lowers both physical and mental stress. So when we talk about stability, on the next slide here, we're going to outline the two different types of stability. So it can be divided into both dynamic and static stability. Dynamic refers to maintaining a stable body position throughout a movement. So this includes things like walking, squats, and sit to stands. As for static, this is like maintaining a stable stationary position with no movement. So this could be like a 1-foot balance or a semi-stand-up stance. So when we're looking at ways to actually improve stability, there are a couple of exercises that we can do. The first we can do is a single leg stance. And this is basically when you put a chair or a wall in front of you and lift 1 foot off the ground and try and balance on it for 30 seconds with as little support from the chair or wall as possible. This is a static exercise, so there is no movement. And then the next one, we have tandem walking. And this is basically walking heel to toe in a straight line while maintaining an upright posture. And you should attempt to do this for at least 10 steps and work towards not needing a wall or anything to support. And finally, another exercise we can do to kind of improve stability is our sits to stands. And you do this by sitting on a chair or by sitting on a stable chair, and you concentrate on distributing your weight evenly on both feet and rising to that standing position. So it's almost like a reverse squat. And you then want to lower your back down and then repeat that exercise. So we have two other little exercises that we wanted to mention as well in the next slide. We have the bird dog, and basically what the bird dog does is that you're going to start in a tabletop position on all fours with your knees under your hips and arms under your shoulders. You're going to maintain a neutral spine, which means you want to maintain it so it's straight and not gaping like this. So we want to make sure it's as straight as possible. And begin by lifting one arm and one leg off the ground at the same time. So you want to make sure when you're doing this, you're doing the opposite so you don't tumble over. And basically, when this gets easier, you're going to kind of try and do it faster. But to start off, if we want to just start and we're not at that strength, we can just lift one arm or one leg at a time. And lastly, we have seated knee lifts. And to do this, basically you begin in a seated position on a stable chair, sitting upright without leaning on a backrest. And you're going to squeeze your abdominal muscles and you're going to raise one leg up a few inches off the ground and then lower the leg and then repeat it on the same side. And you're going to continue bracing your core and kind of holding the edge of the chair as needed with support. And as time goes on, if you find yourself getting really strong in this exercise, you can actually transition it to laying on the floor and lifting one leg up at a time on the floor, and it makes it just a little bit more challenging. Or you can do things like adding ankle weights or resistance bands to the bottom of your leg, so it's a little bit harder to lift your leg up. So then on the next slide, we're just going to talk a little bit about the relationship between exercise and stability. Basically, deficits of stability and balance can be reduced through exercise. An example of this is how improved stability can actually reduce lower back pain. So a study has shown that performing core stability exercises are effective at decreasing lower back pain and may improve physical function. This was a short-term benefit, but as the effects were lost months later when the participants discontinued the exercises. So if we want to keep this core strength we're building, we want to make sure we're doing it routinely. A really good example of this was my partner actually had lower back surgery, and one of the key things they suggested he do to maintain that back strength as time went on was to do these core exercises, and now has become a part of his daily routine. Another study actually looked at the physical activity programs for balance and fall prevention in the elderly, and that's just on the next slide here. It was a systematic review, and basically they found that physiological decay is natural with aging, which can cause a decrease in balance ability and increased risk of falls. Physical activity has actually been proven to reduce the decrease in stability, and the study actually concluded that exercise is a key strategy in preventing loss of balance and increased fall risk that accompanies aging. So as exercise is continued throughout life, long-term benefits show that the benefits of training stability can be lasting as long as the physical activity is maintained. So a really important thing we want to emphasize is that when we're working on stability, we want to start right away and maintain this work as time goes on. It's not going to be a short-term thing that we will reap the benefits of for a few months to a year. It has to be part of our daily or weekly routine in order for us to actually see the long-term benefits. We can also improve stability in different ways other than exercise, because basically stability can be increased when we lower something's center of gravity or increase its size of the base. People can also go through a variety of different strategies, like standing with their feet spread apart for a larger base of support, bending the knees to lower the center of gravity, and use canes, crutches, walkers, and increase the size of that base. However, if we're starting exercise now to try and decrease the chances we're going to be needing those canes, crutches, and walkers. These are really quick changes that can make you feel a little bit better feel a little bit better about yourself if you do feel like you're losing balance. But if you don't feel like you're losing balance at this moment in time, try working on implementing those exercise strategies first and working your way, if needed, to these ones here. So we do have our next exercise here, but I'm not sure if Dr. Curnew wants to talk about anything with stability. If not, we can just...
It's an important concept is that we tend to fall. And I noticed that one of the reasons I got involved with this is that I don't feel as stable as I used to. Just standing on one foot off the ground is not so easy anymore. And so I think I appreciate some of those exercises there. So I think, you know, for anything to get better, you have to train a muscle, and it's something that you need to work on before you fall and break your hip, because once you break a hip, the chance of you dying in that next year is almost 50%. And so it's, I don't want to wait till that point in time. That's why I'm doing it now, and keep telling us more how to prevent us from falling and get more stable.
Yeah, so I know we talked about a lot of exercises so far, but the next exercise is something we hadn't mentioned yet, and it's called sidestepping. So if you are at a table, we're just going to get up and we're going to put our arms at a table. Unfortunately, my table's a little bit short, but that's okay. And basically what we're going to do is we're going to try and stand straight up and use the table for stability if needed. I'm just going to do the little bit more of an advanced version because my table's a bit too short for me. But basically what we're going to do is maintain an upright, well-postured body stance. And we're going to take one step to the side and then take another step to the other side. And what you really want to do here is making sure you're maintaining that good body posture and engaging your core as you do it. So we're going to do 8 on each side. So I think we've done 2, 3, 4. And a way to kind of make this a little bit more difficult is to hold a weight with you. 5, 6, 7, and then that's 8. Awesome. So that's kind of the little talk about stability that we wanted to go through. Next, we're going to talk a little bit about the persistence, about remaining persistent and motivated in order to exercise. Okay, sorry about that. It looks like the person who was going to cover that had to step away. But when we're talking about persistence and motivation, it's important that we are staying consistent with exercise because it can, in order to provide and sustain the benefits that we had talked about. So things like lowering risk of heart disease, improving sleep, improving cognition, lowering weight gain or helping with weight loss, fewer symptoms of depression, anxiety, increased sense of purpose, providing structure and meaning, boost energy, and increase social connections. So in order to kind of keep those benefits staying in our lives, we have to keep exercising. So some tips we wanted to share about staying motivated when we exercise is the first is to start slow and work up. It is really important to kind of gradually increase the intensity and frequency of your exercising, especially to prevent injury. This will also ensure that you can stay consistent over time rather than setting potentially an unrealistic goal from the beginning. You can talk to your family practitioner or maybe other peers and choose the right exercises that are actually appropriate for you. The next tip we have is to make it fun or social. So finding a workout buddy or doing group classes, like we've mentioned before, going back to that running example where there was a group running treatment, exercise therapy. These group settings are a really great way to help you remain accountable and help you achieve your goals. Your exercise time is yours, so you should choose exercises that you enjoy and people you enjoy spending time with in order to do them. Lastly, avoid the all or nothing approach. So individuals who go without exercise for a while might actually see exercising as a pretty daunting task. So remind yourself that you deserve kindness and understanding, and missing one day or one session if you have a super busy week or maybe life events have come up unexpected will not hinder your process. You're capable of more than you think, and muscle memory is a really important phenomenon, but it's really important that we do remember we're not skipping so many days, but it's also important to remember that we should give ourselves grace if maybe there's a date that comes up where we can't really exercise. So we have the next exercise here, the last one we're going to go through today, and that's going to be hip rotations. So basically, what we do for this exercise is you're going to stand with your feet together and your hands at your hips, and you're going to rotate around while trying to maintain your balance. I have pretty poor balance, so I know I'm going to have to do these exercises myself at a later date and consistently in order to improve it. But basically, you're going to rotate around in circles like you have a hula hoop. And you want to do this at 8 reps. So since we're going in one way, we're going to also go the other way. So we'll say we did 3, 4, 5, 6, 7, and 8, and we're gonna work our way the other way around now. So 1, and again, if you want to increase the difficulty on this, You can use a hula hoop, or there's other different kind of tools that you can get on like Amazon and other things. And I apologize for my dog barking there, but there's other ways you can kind of increase the difficulty on this as well. And that's 6, 7, 8. Awesome. So thank you for spending your Monday night kind of working out with us there, but we're not quite done yet. We wanted to just give a little shout out, especially because we want to drive home that point that you're not alone in your exercise journey. So we do have a bunch of different resources for you. So you can check out our website here at www.drcurnewhealth.com. And another thing, going back to your whole community setting, we do have a Wednesday group called the Motivation, Mindfulness, and Moving, or 3Ms group, which meets every Wednesday at 7 p.m. on Zoom. This is a wonderful community of dedicated patients and volunteers who love supporting one another. And if you're interested, you can sign up in this Google form or visit Dr. Curnew's site, or just let Dr. Curnew know at your next visit, and he can put you on the list to join those sessions. We also have our fun little YouTube channel where you can exercise with us volunteers. We do have some exercise videos, and on the next slide, I have just kind of shown how you can kind of find them. So if you go into Dr. Curnew's channel and go under playlists, there'll be an exercise video playlist where we'll have a bunch of different exercise videos and workout sessions that you can do with us. And to access this playlist a little bit more easier, we have a link here. We also have a bunch of different other groups rather than just exercise to kind of help support your health. So we have the Sugar Club, weight loss group, and Sunday dinners, who all work to try and improve your health in different ways. And they're really great groups to be a part of and run by some fantastic volunteers. And then that is all for our webinar this evening. And if you want, you can connect with us through our email at drcurnew232@gmail.com, our YouTube, which is Dr. Curnew, or our website, which is again, drcurnewhealth.com. Dr. Curnew, I don't know if you have any last kind of words you want to share with the team before we sign off, but yeah.
I wanted to thank Haley and the entire team for putting this together. This sounds really something that is underutilized. I have everybody that says to me, I want to use less medications, I want to feel better, but I don't have time. Unfortunately, starting in your 30s and 40s, time starts to decay. Your body is wearing out, your lung function decreases, your body mass increases for most of us until the last couple of years in our lives. This is a way of compressing illness towards later life. I don't know how much time we all have left. Once you over the age of 50 years of age, your immune system starts to fail, body parts start to fail. And to me, is that this is such a huge opportunity to make a huge difference. I think exercise will prolong your life, but more importantly, it will make you feel better. It's a good treatment for depression. It's a good treatment for cancer. As we gain weight, cancer goes up about eight cancers, from breast to colon to prostate cancer. A lot of the GI cancers are all associated with increased weight, and exercise helps maintain. Now, I think for weight reduction, exercise by itself isn't that great for weight reduction. It's good at maintaining weight reduction. And this is so vitally important, is that I don't know how much time. I've actually calculated my life expectancy. It's a formula. I'm not sure how accurate it is, but what I can do is I can press the amount of time I'm in illness. So I play hockey badly. I run badly, I exercise badly, but I play squash not too bad. I can do the CN Tower not too bad. But it doesn't really matter. I'm just participating in different activities, and I'm incorporating those 3 forms of activity. One is just regular walking. This year I'm walking 12,000 steps a day. That's my average this year. Last year was 11,000. So if I get over 10,000 steps per day for a year, I'm happy. Number 2, intensity. I always like squash, running around, hockey. I've been doing that for most of my life. What I haven't been doing is that weight training. Again, we lose 50% of muscle mass between the ages of 30 and 40 and 70. I lost a lot. I'm trying to let's decay some of that and get a little bit about that back. Some people say a VO2 max, which is the amount of horsepower that you have, is one of the key determinants of how long you're going to live. I don't put all my eggs in one basket, but I put exercise. You mentioned stress management. I really love that Wednesday group, and I realize that I have many thoughts that go through my mind, somewhere between 20 to 80,000 thoughts that go through one's mind. Many of them are unpleasant, repetitive, and being aware of that and just learning how to laugh at yourself and dealing with that's been a great group for great part of that the mindfulness group. I found that very helpful. Trying to get those extra 10 pounds off for many of us, or 20 or 30 or even 100. It's very doable if you put your mind to this. So I'm doing it. You're doing it. I just got a text from Bruce from the hockey team. He says, "Have a good trip," and so there you go. So I play hockey once a week, and I really enjoy that. And I'm not very good at it, but I sure have a lot of fun at this. So please do this. Please take this very seriously. Find the time and effort. If not, you're going to get closer towards the nursing home. And I really like this idea of delaying chronic disease. And one of the things is that activity, better sleep. And I'm working at that too as well. None of us are perfect. I don't get mad at myself for being not perfect. You mentioned about trying different things. One of the things I'm learning how to fly a plane glider. I'm over 180 flights in 2 years. I can't fly the plane yet, but I'm getting better and closer. And I'm not setting a time frame. Most people will fly a glider well less than 100 flights. I mean, it's going to take me longer. So what? I'll get there. I'll take my time. But I'm working at it, and I just persevering. And I thank the people at SOSA for teaching me, taking the time about this. And I thank you all, especially all people like you, Haley, and the rest of the group, for really making this really doable. And thank you. Amir, what's your thoughts?
Yeah, I think you summarized it really well. Exercise has lots of benefits for mental health. We saw the study about depression, the motor trial. We saw how exercise can improve erectile dysfunction, sleep, and stress. And we like you said, Dr. Curnew, there's a lot that stress can do to your body, and exercise can help reduce stress and stability in falls. Exercise can help improve stability and hopefully, help with fall prevention. So I echo what you said about the team's work. This was an amazing webinar, and yeah, those are my thoughts.
And one way to help release some of my stress is getting your medications right. We started off with Pearson Airport being a difficult place. Managing your prescriptions has become a very difficult challenge. It shouldn't be a difficult challenge. You should know what you're taking, why you're taking, how many pills you have left. If again, if you had the checklist of for a plane to lift off at Pearson Airport, you would never lift off if you didn't go if you didn't know your medications properly, didn't know what you're taking, why you're taking, how many pills you have left. Can you imagine driving your car not knowing how much gas is left in your tank and how many pills you don't have left? I don't know is an answer I get from too many people. The pills I gave you was, I told you that last time. That's wrong. And I hope I can change that culture before it's too late. I understand that some people just don't have the mental ability to do that, but I think 90% of us have that ability. And if you don't have that ability, we need to help you with that. Let us know and get a family member involved, because what I have learned about medications is that 50% of people who are prescribed medications don't take them or stop them after a period of time. Most doctors outside of their field don't know the right combinations of medications you should be on. And so getting this right takes a lot of work. And to take less medications, exercise, get better sleep, mindfulness. These are so important. And I thank you so much for bringing that back. And I thank the groups that work with me, from my hockey group to my squash group to my tennis group. to my family who are make exercise part of their religion, and to those Monday and Wednesday morning groups where we start off the day in the dark now and with different exercises, different weights. And thank you, Eric, and thank you everybody for teaching us how to do better. And I know you can improve on yourself and move up one step at a time. So I think with that in mind, I think we'll say goodnight to everybody. And I hope people will take a look at this, try these exercises. I know Anna will, and others. So have a great night, everyone.